Yeah, sure.
One on infrastructure. Members of your administration and members of Congress have pointed out that the top paid federal employee, it's not the president, it's the head of the Tennessee Valley Authority, and he made $8 million last year. And
It's ridiculous. I agree. It's ridiculous. I think it's the highest paid government. Long before I got here, you said Tennessee Valley Authority, right? Has to be the highest paid man in any government. Makes approximately $8 or $9 million. I don't know the gentleman, but he's got a heck of a job. He gets paid a lot of money. He's been there for a long while, hasn't he?
This one actually is new, came in April, but the previous
Well,
one
that's a separate, yeah, that's separate. But I'm talking about we just have some new people going on the board, I know. But as you know, that's a quasi-public agency. And whoever the head of the agency is, that person makes a lot of money.
If I could ask my second question.
Which is an amazing thing, right? And when we want them to do something, they're not there for us. That's not good. That's not good.
The second
They've been there
question,
for a long time. That's been a story for a long time.
and I assume that you would support reducing that salary as part of the infrastructure bill.
Yeah, reducing it by a lot.
Thank you. And, my other question
That'd be
is,
the greatest job in the history of government, almost. Certainly if you're into money. Tennessee Valley Authority, that's right. Go ahead. I've been waiting for somebody to ask me about that. It's been bothering me for a long time, too. Go ahead.
One of the biggest rating hits of the coronavirus, aside from these briefings, has been a show on Netflix called Tiger King.
Yeah.
And the man who's the star of this is a former zoo owner who's serving a 22-year prison sentence. He's asking you for a pardon, saying he was unfairly convicted. Your son yesterday jokingly said that he was going to advocate for it, and I was wondering if you've seen the show and if you have any thoughts on pardoning Joe Exotic.
Which son? It must be Don.
It was.
I had a feeling it was Don. Is that what he said? I don't know. I know nothing about it. He has 22 years for what? What did he do?
He allegedly hired someone to murder an animal rights activist, but he said that he didn't do that, and he was.
Do you think he didn't do it? Are you on his side?
Well, I'm a reporter.
Are you recommending a pardon?
No, I'm not advocating anything.
As a reporter, you're not allowed to do that. You'd be criticized by these. Would you recommend a pardon?
I'm not weighing in on Tiger
I don't
King.
think you would. I don't think you would. Go ahead. You have a question?
I do like Joe Exotic.
I'll take a look. Is that Joe Exotic? That's Joe Exotic.
Let me get back to
Go ahead.
the coronavirus if I can, Mr. President.
Yeah.
Last week, your top experts were saying that we should expect 100,000 to 240,000 deaths in this country. You've been talking about how it looks like maybe things are plateauing. Are these numbers now being revised downward? I know you don't want people to stop social distancing and that sort of thing, but what can you tell us about the numbers? Are they being revised?
My impression, Jim, is those were the numbers that were set, and they were set as an expectation from quite a while ago. I think we're just doing much better than those numbers. If either of you would like to talk about that, it's a fair question. Do you want to come up, Deborah?
I know Dr. Redfield said something about it too.
Yeah, so I think many of you have done the analysis of the same models that we utilized. And if you do the models of the models, you end up with that range. At the same time, we carefully looked at Italy and Spain, and we are doing much better in many cases than several other countries. And we're trying to understand that. We believe that our healthcare delivery system in the United States is quite extraordinary. I know many of you are watching the Act Now model and the IHME model and they have consistently decreased the mortality from over almost 90,000 or 86,000 down to 81,000 and now down to 61,000. That is modeled on what America is doing. That's what's happening. And I think what has been so remarkable, I think, to those of us who have been in the science fields for so long is how important behavioral change is, and how amazing Americans are in adapting to and following through on these behavioral changes. And that's what's changing the rate of new cases, and that's what will change the mortality going forward, because now we're into the time period of full mitigation that should be reflected within the coming weeks of decreasing mortality. I mean, that's what we really hope to see. We are impressed by the American people. And I think models are models.